Welcome, everybody. This series of talk are part of the Distributed Answer to a Global Crisis. It's an online event that we organize in FabLab OpenDot in Milan as a part of a EU-funded project called the Distributed Design. The objective of this EU-funded project is to connect designers and makers with the market. And what happened during the last unfortunate periods is that the maker community really stood up and held and got into a very active role to tackle the spread of the virus and to, compensate for some lack in the industrial production or some delays. And the reaction of the maker community has been amazing and has been global and worldwide. So because OpenDot worked on the field of health and care since the last few years, we thought it would be very interesting to discuss the main key points and topics of what happened. And one fundamental key point is definitely the role of communities. So ideas by themselves are not enough, machines by themselves are not enough. The people are the one doing the change and impacting the most. So we decided to interview and invite the largest community, I think, at the moment working on this. And in particular, Sabrina Merlo, that is local response leader for OSMS. Thanks, Sabrina, to be with us today. I let you speak, and I give you the stage. So if you want to introduce yourself and tell us what you are doing.
Sure. Well, I'm happy to join you to share a little bit of this story of 9 weeks at Open Source Medical Supplies. I think we're just past 9 weeks old. Open Source Medical Supplies, as many of you know, is a Facebook group. It's just a public forum for makers, crafters, manufacturers to share information about open source designs for medical supplies and other strategies dealing with the coronavirus pandemic. You know, it's designed for people to share information, to pool resources, to connect with collaborators, fundamentally the definition of an online forum. It was started by this friend of mine, Guy Cavalcanti, the guy in the Navy jumpsuit, who I know from my 10 years at Maker Faire. I was at Maker Faire from 2010 until June of 2019. And so we worked together on some of his projects. One is this entertainment giant robot fighting project called Megabots that he was involved with, and we did some shows together. But also I worked with Guy when he was doing some series of early talks around how to make a makerspace, because he's the founder of Artisans Asylum, one of the largest makerspaces in the United States, which is just outside of Boston. He also, though, most recently has been the CEO and founder of something called Breeze Automation, currently an R&D soft robotics startup in San Francisco. But in about early March, he started to have difficulty continuing operations. He was not able to get supplies for the robotics company, and started to pivot his attention to what was happening with the breakdown of the supply chain from China as China went into shutdown. You know, news evolving, Guy watching, Italy goes into the nationwide lockdown on March 9th. And then on March 10th, Guy created the Facebook group. Open source. Well, it's actually the original name of the group was Open Source Ventilator Project on March 10th, because that was really probably the initial spurt of sort of maker interest was focused on this question of our limited ventilator supply in the wake of an explosion of the virus. But in some conversations with his community of medical folks, surgeons, and friends over this 24 hours, Guy realized that the issue was not ventilators. The issue was protecting the people who have been trained for years and years who might actually be the ones administering the ventilators, that PPE and other supplies were probably a bigger issue, which is why he changed the name to open source COVID-19 medical supplies. Initially, I think, of course, like any Facebook group, it's a manifestation of the founder's personal network. And I think Guy's background crossed a lot of disciplines and communities, and that was the initial sort of seed for the group. But that with the zeitgeist, this group exploded. In 1 week, there were 12,000 members. I joined somewhere in the first few days there as part of his extended network. But very quickly, it clearly tapped into a vein, and a back channel started in Slack. This was a post from one of the people wrangling Facebook. She was talking about how quickly the following was building, and I think part of this is this cultural leaning from the maker community, and potentially Guy's community, if you want to use that as an extension, towards duocracy. It's an organizational structure in which individuals choose roles and tasks for themselves and execute them. I mean, this is a community that has a great sense of initiative and purpose. I'd say it's a generous culture, and the idea of being able to contribute something was hugely motivating. So again, Slack was a big tool we used. This is where we are at Slack today with 823 people in the open source COVID-19 Slack. The idea of the Slack channel is not to produce designs. This is to manage the information around the designs that we're seeing, as well as the connective tissue and representation of local response groups around the world. Also a function for communication across the Facebook moderator team. And the group is just like a forum any maker forum that you might see. People sharing images of projects they're developing and asking a lot of questions. Lots of extended responses and exchange. Highly productive, and really serving innovation in a kind of rapid format. So 8 days into the organization, the version 1.0 of the medical supply guide was launched. This was basically the work of a team of medical folks working with engineers to review and assemble what they thought were the best designs emerging from the Facebook community. So this was before we had any hospitals committing to accepting open source supplies and locally produced designs. And so I believe this group took quite a risk to actually try to clarify and curate a list of designs that appeared to be to serve the medical community's needs and the social services community needs by a team of reviewers. 19th of March, so the next day, we started seeing press around Kristin Kazi and team's Venturi valve, which, just to give you a sense of the time frame of this. Again, super galvanizing story for the global maker community. And in 2 weeks, this Facebook group had 49,000 members. This is a private Facebook group, so you can't just, unless you answer all of the questions satisfactorily, you don't get automatically added. So there's a percentage of these folks that are manually reviewed and accepted or declined. Plenty of bots were declined in the creating of this group. And the frenzy of information was coming in like a fire hose. This is a post from one of the main moderators, or became a moderator. She was talking about posts coming in every 1 to 2 minutes. And this was a discussion about implementing posting approval. But the challenge, initially the group was an open post, so anybody could post whatever they wanted. And we were seeing this amount of noise and the quality of information declining. So on about March 20th, we chose to turn on the Facebook moderation and really take on the work, because it was a lot of work, of reviewing all of the posts and turning it into a curated forum. So this, this was a turning point for us. Again, this is only, whatever, that's 10 days basically into the project. More back channel conversation. Guy, I mean, this was not a phenomenon or a project that anyone really expected to dive so deeply into. Again, the zeitgeist, Hillary Clinton. We know her as the last Democratic presidential candidate, posting about the lack of PPE in our hospitals. And about this time, makers are really turning on the production lines, whether it was themselves in their homes or in their garages. But we were seeing in the forum a lot of chaos around makers with 10 face shields calling up their local hospital to see if they could donate or what they could use, or could they approve their design. And so there was a decision to really put some energy into a local response guide, which I was quite involved in, really as a best practices guide for local teams and individuals working to produce and distribute open source PPE and medical devices. The idea was to try to help people with strategies to pool resources, to scale production, and to really continue to be a major asset to the medical community instead of an annoyance. At about the same time, at 3 weeks in, we did our first, Guy did a poll where he asked people to share a tally of what they had produced, images, where they are, what they made. And I think over 500 post responses later, we ended up with this count of 238,000 items. Again, this is a Facebook algorithm. This is a tip of the iceberg picture of what is being produced worldwide. This is a dominant, US forum. So this is just a snapshot of what I call the tip of the iceberg. And in 3 weeks, we were at 62,000 group members. At 3 weeks also, we were able to secure some funding for the organization, actually, and succeeded in transitioning to an organization at 3 weeks, where we had a fiscal sponsor for a nonprofit, and we started to actually do the work of articulating who we were as an organization and what our goals were. Our program focus, open source authority, constantly evaluating and propagating best practices, designs, and standards as they evolve with vetted information sources and secure systems. An ecosystem nexus, connecting with relevant communities, for example, hospital systems in need, fabrication groups, design groups, philanthropy, and partnering for effective coordination of a global ecosystem. And third, local response blueprints, helping stand up local chapters and distribute responses throughout communities around the globe. This included support in community building, communication strategy, organization. At 4 weeks in, a YouTuber, maker, influencer, US author released a video that went quite viral on how to help your hospital. This is an effort, a local response effort in Alabama. And this team, this is an incredible documentary of the kind of distributed manufacturing that was happening in communities. I still haven't seen a better portrait of what the organizational approach towards these local response maker missions initiatives are. So if you haven't seen this video, I recommend checking it out. It's a portrait. At 6 weeks, we were working with a lead who had access to a large pool of translators. So at this point, there's 400 plus translators working on 54 languages to translate the medical supply guide as well as the local response guide. But not just to translate. Actually, the bigger goal is to localize the information. So to collaborate with medical professionals as well as makers and manufacturers in these regions to make the information relevant to those local communities. Quite a project, as you can imagine. And then at 8 weeks, we saw some, here's the production. So we started doing this weekly tally and count every week. This is the look at 8 weeks, and we heard that Lithuania had reached self-sufficiency. I will say that actually this group in Alabama was the first time I heard of a local response network satisfying a region's PPE needs. And this was the second with Lithuania reporting. I also wanted just to share with you a picture of what we covered in the topics of the medical supply guide. This is recent, the most recent issue, and these are the open source designs categories that we have in the medical supply guide. So everything from goggles to shoe covers to nasal catheters, oxygen masks, hospital beds, ventilator machines, but also humidifiers, pulse oximeters. It's quite a range. And at 9 weeks, we have stabilized out at 73,000 members in the group. We have people leaving and people joining at a rate that is sort of stabilizing the group capacity. I think engagement is reflecting to some extent the PPE and the sort of stabilization we're hearing about. That given the success of most of these shelter-in-place initiatives, that we have to some extent flattened the curve of the virus, and we're seeing some news pop up on my screen, and that's reflected, I think, too, in the output that makers are seeing. You can see there's a dip here in the reporting. Again, the tip of the iceberg reporting, but you can see that week 6 there of the count, which was actually week 8 of open source medical supplies, was the peak. And then the week ending May 8th, we saw a decline a bit. 10 weeks, we're in 10 weeks. I think conversations are starting to happen in the forum about what it means to re-enter from lockdown. So conversation, for example, took off yesterday in the forum around how a large community college in Florida might do planning around how much PPE and things like hand sanitizers they would need to operate safely. So how do you make that projection as an entity or an institution based like on per capita numbers? Like those kinds of questions. Again, there's not tremendous information out there that we are hearing from a top-down authority. So a lot of this information, again, is local, and intelligence is distributed and requires crowdsourcing for us to get ahead of this best we can. We're also doing some coalition work and ecosystem mapping of this whole local response, trying to get a great global picture. We're working with the FAD Foundation, Tikkun Olam Makers, and Nation of Makers in the US. We're having a conversation this week in the OSMS local response community on scaling with manufacturers and some of the experiences and case studies we've seen of makers and makerspaces operating almost as prototypers, and then local manufacturers, prototypers and community organizers, building the relationships with the hospitals, coming up with the design that was approved, and then engaging with local manufacturers to move to things like injection molding and die cutting to actually scale production. I think those relationships, those collaborations are new, and we're going to have a conversation about what that's been like. Guy is doing a keynote at this weekend's 24-hour virtual Maker Faire. And we're in big work transition, trying to finally move the design library and the local response resources online to a website with a better user experience. Emerging issues and questions and things we're thinking about are, as certain regions calm down, where is there the best information about hotspot monitoring as things emerge, and how will makers pivot if their local needs are satisfied? Are there mechanisms for distribution to areas, not just efforts, but distribution efforts, but also like where are the resources as well for helping other communities that are in need? And also, I think a big question from an organizer point of view, like myself, someone who's been working in the maker community for a long time, I'm very interested in what policies we might articulate that really can support and recognize this distributed manufacturing effort that really has contributed a lot, has saved lives in this situation. How are we conceiving of these networks of makerspaces, fab labs, and individuals, universities, as an emergency response, almost a national security asset? So I think these things will take up some thinking and some work in the near future. And then again, it's only 9 weeks in. So that should give you a little bit of a picture of the experience at Open Source Medical Supplies. And I'm looking forward to having some conversation with folks in the audience.
So what you told us, it's an impressive journey. And what shocks the most, I think, it's how fast this machine moved. And that was my first thought. But the second thing is that it's a completely different paradigm from the industrial one or the startup one. So with the startup, you focus on the idea. When you have the idea, you protect it as much as possible, and then that's yours. If you lack the skills, time, money to scale it up, the idea dies. While the idea of duocracy, so if you do it, you own it, it's something quite unique, I would say.
I think is a very rewarding experience for people. I mean, we had the combination of people actually being laid off, or people being sent to work at home, or people being furloughed. So it collided with a moment where people had a lot of free time comparatively to how they've been operating. Even if it's just they worked during the day and did production at night, people, especially as we sheltered in place, there's not a lot of other, so that was an opportunity to the extent to which we were riveted as an international community on this really rare moment where we had a mutual threat. So I think that was galvanizing. I do think, though, that the tone set around contribution, discussion, managing that conversation, as a forum, and continuing to nurture a productive environment where people could actually learn and turn around and produce. But, we've been working, the maker community has been building this infrastructure for a long time, through festivals like Maker Faire and people meeting each other, but also through standing up these fab labs and maker spaces and building networks, for the last 15 years. So this was the moment at which all of those investments, as well as the opportunity for the digital fabrication tool set, which is like still a new thing in terms of access to this powerful tool set. Like all of these things converging, I think created the environment for this level of engagement.
The other thing that you were talking about that was quite obvious in the evolution of what you went through is that community are not something that magically work by themselves. So there is this idea sometimes that a community is just a group of people and everybody agrees on what to do and they work together. While there is a complex set of skills, management skills, to actually be able to run such a large community. So do you have, or can you share any insight or some particular cases that you think it could be useful for makers and public managers that have to deal with smaller communities, but with similar dynamics, I would say?
Well, I think there's been a lot of intent and energy spent on crafting and revising language that articulates the vision and purpose of the entity. Now, most people probably would not be aware of the changes in that kind of language, but what it did was it built consensus and understanding and team across this distributed network of volunteers that were at the back end of this organization. So that I think as this situation evolved, the organizing team had a sense of purpose and a sense of consensus around some of the nuances that inform a culture. So I think that was important. I think we had Guy is a very strong leader as well. Like he had a vision, and we all know that leaders galvanize energy. And I think that his choices and personal network really informed a lot of the energy there.
Another interesting point, in my opinion, is that as soon as you notice that the community was growing, you set up an organization. So you formalize the structure, you look for investments, you start to talk to policymaker, I guess, because you said that was one of the topics you were interested in. This is not so common unless it's a very well-structured community. Very often communities has this problem of stay small because they don't want to get into that level of organization. Do you think it's
well,
again, common?
Yeah, I know it's not common. I think it speaks to the people. Again, it speaks to the run-up of this. For example, our funder is someone who helped us have a maker fair in the White House in 2014. So you know, there is an effect of many years of work across this distributed network of people that manifested at this moment. So it's an interesting case study, and I think again as a leader, Guy, when I said, what about funding? And we had the conversation. There was a pretty immediate consensus that we should become an organization to support the people that were working this hard to run this, or to sort of manage this community. The scope of work was large enough, and it seemed. And we didn't spend a lot of time debating about whether this was a compromise to the organization. Probably zero. Which again is maybe just a reflection on the people involved. Guy has run businesses. I come from a business background. To the extent that Maker Faire was not an NGO. It was a very mission centered. But it was a business, so I think there was not a bias towards actually formalizing the entity, but could have gone other ways. It happened very fast.
Hmm. One last thing that I'm very interested in. You said we are now pushing or discussing policies to explain that the maker movement has a value. I think it connects with the fact that this amazing response happened in a moment in which people were highly motivated to fight for a common cause, and they had time to do that. So it really flipped the idea of working 24/7, very hard, and focusing on only one thing. And when I went through the projects in OSMS, I found things that were ranging from I don't know, old patents from the Navy, as well as brilliant ideas from someone just tinkering with stuff. So, do you think that this could be a model for facing other global crises that we're living in? And if so, what could be the steps in your opinion?
I do think it's a model. I mean, this is the greatest crisis we have experienced in recent memory. And I think I've been at conferences in the maker community. I'm sure at Maker Faire, we program talks on this idea of the Makerspace and Fab Lab network as an emergency response entity. We've seen shipping container digital fabrication labs being sent to Syria, actually out of the Burning Man community. We've seen similar sort of deployments of tool sets into like hurricane environments in the Caribbean, but this had not this had not manifested in a case study as of yet. So I think my focus right now is on capturing the case studies. That's why the weekly count is important. And actually, trying to express this tip of the iceberg around the impact. And I encourage anybody that's working in organizations to register their group. You can see the local response registry at opensourcemedicalsupplies.org, because I do think the case study and the storytelling are going to be important to being able to share this still sort of underground story of the impact that local makers had. So policies, of course, are multi-layered, and when you're talking to an international community, they're unique to each country, if not each region. So it's work. But if we could come up with some examples of recommendations and get some initial prototypes in place, it will be a model, I think, that can be followed internationally.
Well, you were talking about the differences in local communities, so I went back thinking about your local response guide and the fact that even if it's a global community, you're putting a big effort in translating things. So there is a huge importance in localizing the knowledge using not just the language, but supply chains, materials, traditional skills, and so on. Do you have the feeling that legal frameworks, certifications, policies, and so on, being national, are somehow slowing down a lot of the potential that could be seen?
Well, there's reason why we have medical supply certification. I mean, there's a lot of rationale and good logic behind that. And I think what we saw is that works. I mean, outside of the environmental costs of the waste stream from the medical supply industry, which is a whole other question. But if what we see is that in an emergency, there are needs for emergency authorization. And if a country has the benefit, or a region has the benefit of the supply chain being intact, in some respect, there's no need. Why not, provide the best to our healthcare teams? But in this case, the medical supply chain broke, and it was a grassroots effort that, in some cases, we're making supplies and bicycle messengering them directly to the doorsteps of medical professionals, absolutely skirting the institution and going direct to practitioners who needed supplies and whose institutions were on the line and really having a hard time adjusting to this reality, and having kind of top-down consensus around how to deal with it. So emergencies call for unusual activity, and we should be prepared. I think this is what is opportunity is like. In the U.S., we have a National Guard that is in some ways emergency response. Military. It really was dormant almost all the time, and comes alive and that is kind of how I can imagine this being envisioned.
That was beautiful. Thank you so much. It was great to talk to you, and the journey you brought us in was amazing and inspiring. So thank you very much, Sabrina Merlo, local response lead for OSMS. This was one of the talk, part of the distributed answer to global crisis, the online event organized in OpenDot for the digital distributed design European projects. Thank you very much again. It was a pleasure to have you with us, and I wish you really all the best for the huge effort that you're putting in.
Thank you.